Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. On this episode of the podcast, I am speaking with Amma Gyamfowa, Networking Coordinator for Women's Health and Women's Hands, and Kashaia Henderson-Doyle, Student and Family Advocate Program Coordinator at Women's Health and Women's Hands Community Health Centre in Toronto, Ontario. Women's Health and Women's Hands Community Health Centre provides a wide range of health and social services geared towards the diverse needs of racialized women, trans, and non-binary clients from the African, Black, Caribbean, Latin American, and South Asian communities in Toronto. How are you both doing today?
Doing good, doing well.
Awesome.
How are you?
Good. So first off, I would love it if the two of you could tell me a little bit more about Women's Health and Women's Hand Community Health Centre, some of the main aspects of your organization, the communities you serve, and the services and programs you provide. Emma, if you'd like to start.
Sounds good. Well, thank you for having us. So Women's Health and Women's Hands has been around for about 30 years. We're located in Toronto, downtown Toronto, so really in the center of the city. And some of the main aspects of our organization, so we are the only organization in Canada that's mandated to specifically address primary health care for the communities that you mentioned. So folks that identify as African, Caribbean, Black, Latin American, and South Asian. And we do all of this work from a very holistic lens. Folks can be able to access a family doctor. They can be able to support their mental health by accessing our mental health therapists. They can be able to get supports from a nutritionist. We do a lot of diabetes education and awareness. And then, of course, we have community programs that me and Kashaia will talk about a little bit later. But our mandate and purpose is really to ensure that we are addressing the healthcare needs that is often neglected, in particular for Black racialized folks. And we're doing that in a way that is reflective of people's cultures, identities, and just really affirming in a lot of different ways. The other thing that I think sets us apart from some CHCs is that we also know the importance of research as a part of it. And so that's another major key to the work that we do at Women's Health.
Kashaia, if you have anything else you'd like to add?
Amma pretty much covered all of it, but it just shows the uniqueness of the health center and the services that we offer, because we have clients that are coming all over from across the GTA for the specific services that we offer. So
amazing. And as you mentioned, you have an extensive list of programs for what people would consider a very specific group of people. Why was it important to create these safe spaces specifically for racialized women? Kashaia, if you'd like to go first.
yeah, for sure. In many other spaces within the city or even within the country, racialized women are often overlooked. The studies and the research done on us are very much overlooked. So a lot of places can get away with the idea of, oh, they're not in need, or oh, they don't necessarily need anything. But within our community health center, you could definitely see the need. You could definitely see the demand. Sometimes we are swamped because we service a demographic that has often been neglected and overlooked. So yeah, our needs are extremely important. The studies and the researches are being done within our agency, and yeah, it's definitely a demographic that's been overlooked, and we're just focusing on that demographic and seeing how much we could discover through focusing on them.
Perfect. Emma, is there anything you'd like to add to that?
No, I think Kashaia spoke on a lot of the important pieces of how we've been neglected. And I think one of the things that is always really stands out to me is just the fact that if you talk to most Black, Latin American, South Asian women, trans folks, what you'll find is that we all have these really horrendous, unfortunate stories about trying to access healthcare, whether it be for sometimes ourselves or for our family members. And so we have to consistently talk about racism and the medical trauma that happens for racialized people when we're trying to access healthcare services, and recognizing that it's a larger systemic issue, right? Because the reality is, even as, you know, we always are talking about how diverse Toronto is, but these experiences are still happening to people on a daily basis. And so I think the importance of having these spaces is it actually allows us to be able to, of course, address people's health needs, but then it lets us continue to advocate and name and call out the things that are not allowing us to get supports that a lot of Canadians have access to in a ways that racialized women and folks don't have access to.
Absolutely. So coming from New Brunswick, I don't recall there being anything necessarily specific towards any racialized communities really until we started seeing an influx of immigrants, and then it was immigrant specific. But as a Black woman, it was always white doctors who didn't necessarily, I wouldn't say they didn't provide safe spaces, but coming here and feeling so immediately welcomed in various Black spaces, including within the like these community health centers that I get to talk to often about these different things. It's really invigorating and nice to see, because it's not something that I had experienced in my entire life until moving here, and especially now working in this sector. I get to see a lot of positives around the fact that this work is happening.
Yeah, if I can add one more thing as well, is that as somebody who works with young Black women, one of the things that I feel like ties into this is just how although sometimes you may not necessarily experience these like overt experiences of racism in medical spaces, what you will experience is people saying, oh, that's not what it is, or really quickly being able to dismiss like some of your genuine health concerns. And I've seen that both as a professional, but also in my personal life, being connected to other Black women and us having these conversations. And so I think once again, it just points to the fact that there is and what Kashaia was saying of such a neglect that happens, that doesn't allow us to be well and creates these major vulnerabilities for Black and racialized communities that we have to be able to address. So yeah.
Absolutely. So as we've highlighted, there are all of these different programs at Women's Health and Women's Hands Community Health Center. What have you both discovered working around these programs that impact Black women exclusively?
Well, what I realized is that keeping my program specific for Black women is just realizing that most of my participants never experienced a space like that. And in doing so, they were able to share things that you could tell is something that they never really shared in such a space. Maybe even in their personal life, they never really shared it, but they were able to share it within a space that was not necessarily within their personal life. And it was okay. Like, it's okay for them to share these things. And it's not, like Amma mentioned earlier, like dismissed or just seen as, oh, like, no, that's not real. That never really happened. And when they share their experiences, they realize other participants also shared similar experiences, and that they're not crazy, and that it just really solidifies their experience. And that is extremely important in the service that we provide. Like, outside of the service that we provide, the safe space is just such a feeling of home that they can come to and are new to, but love it and want to continue to experience that, and would love that element in other spaces that they occupy in society.
Amazing. Emma, anything that you'd like to add about your specific program and how that has what it's shown you?
Yeah, I think Kashaia really named it, is that it's a really affirming space. And I think it helps to build just a really new way of people looking at themselves, but also being able to get the supports that they need so that their life can transition in different ways. So whether it be, through share supports in providing, the tools and the spaces around thinking about education, thinking about people's experiences in it, or mentorship. One of the things that I think is noticeable is that a year from people being able to participate in our programs, or even shortly after, there's going to be these major changes that we see in people's confidence and their self-esteem. And again, because we're at a community health center, as we begin having certain conversations about what does it mean for Black women to take care of themselves, or experiences that we have in the education system, we can slowly connect people to healthcare resources that lets them continue to take care of themselves in more deeper ways. And so I think it's just this combination of being able to have really culturally affirming care. And I think it's also really powerful that they get to see people like us that look like us, talking really openly about our own experiences and supporting them, that like they just didn't know it was possible to be able to live life in an unapologetic way. And so I think that those are some of the things that our programs are able to offer.
That's certainly some of what I feel when I am able to be in like Black spaces, Black female spaces. And so I imagine that your client base must really appreciate having people like you facilitating and leading those programs. Speaking of Kashaia, I'd love it if you could tell our listeners a bit more about the networking mentorship program and the student and family advocacy program that you lead, and the results that have come from those initiatives.
Okay, so I'll focus on the SFA program. So it is a fairly new initiative. It just started in 2020, 2019, 2020, really pushed in 2020. And what I provide is student and family advocacy for Black students, but specifically to young Black women. There are other SFAs across Ontario, well, across the country actually, but we are the only organization that provided specifically to young Black women. And it's great. We provide it for young Black women between ages of 16 to 25. And in that advocacy, it looks a bit different, especially servicing young Black women, because the pressures that young Black women have of being a little bit more mature faster and independent quicker. Even though we work with families, a lot of times we work with them solely because they are in charge of so many things. They are responsible for so many things and so many aspects within their lives. So a lot of my advocacy looks like bridging gaps to information that they should be given and they're not given. For example, if I have a student in high school, sometimes they might have a guidance counselor that withholds certain information that should be open to all students, but due to discrimination or due to sexism and the combination of how that looks within an intersectional experience, they don't have the same resources that their other classmates and peers might have when it comes to, say, applying for post-secondary and applying for certain grants, applying for scholarships and things like that. I have students that have really good grades and they are just given the information of college and trade school. And not to say there's anything wrong with that, but they should be offered the same information that other students have and be given the options that they should definitely have access to. So sorry, I bridge the gap in regards to providing that information for them and letting them know the struggles that you're facing. They don't have to be something that you experience throughout your educational experience, but I am here to help them along that journey to ease the pain, to ease the realities of discrimination and sexism and what they experience along their educational journey, so it isn't cut short or they don't have to reroute to something that is deemed easier or something more fitting for them based off someone else's definition and what they want to place upon them, but they know that they can come up with what it is that they want to do and have the ability to do that. And I help them along the way of doing that. So that is what the SFA program has been doing for young Black women within the GTA so far. And it's in its beginning stages still, but it is going very, very, very well. And the participants are enjoying themselves. They appreciate the advocacy. They appreciate the support. Like I said, it is a unique experience and is new to a lot of them. So it is definitely needed and it is doing well.
I think that's incredible. I can definitely like think back to my high school days and would have appreciated something like that existing, being like only one of 5 Black kids in my whole high school. I can imagine that it's very important and doing a lot for a lot of kids. And it's exciting that it's in the beginning stages. I hope that it continues on because there definitely is I'm sure, a need. Emma, I'm just wondering if you're able to tell us a little bit about the HIV/AIDS programs that are at Women's Health and Women's Hands. Because this is, I believe, the first community health center that we interview that has one that we can speak on, even though there are multiple. And we're slowly doing all of our podcast episodes, but I'm really excited to hear about this because I know it's not something every community health center has available.
Yeah, definitely. If you don't mind, I'll actually circle back first to talking about the networking program.
Yes, please.
Yeah, so we started in 2018 as a result of the Black Youth Action Plan. And for those of people might not be familiar, what happened was there was, of course, this ongoing push and advocacy to be able to support Black communities better. And so as a result of engagement across Ontario, there were very specific initiatives that were created. So it was to be able to provide the SNAP program, which is to help children, youth There was also family mentoring programs, but also family counseling programs. And then there was the mentorship programs as well that were built and created. And similar to the SFA project, we are one of the only mentorship projects that specifically are focusing on the experiences of young Black women and girls. And so, what the networking program does is really kind of build in a community network and support. And what we offer is one on one mentorship with mentors in the community. It really allows a beautiful relationship to kind of take place between young Black women and folks and women in the community that are interested in supporting, guiding, and just being able to kind of champion mentees in our program. Over the last several years, we've had at least 100 folks kind of go through our program in different capacities. We provide workshops that talk about health and wellness. We've talked about financial literacy, and then of course having the connections of thinking about things like sexual health, career building. And so we're really a holistic mentorship program that's looking at how to empower Black young women in diverse ways. And I think one of the things that is really beautiful about both mine and Kashaia's programs is that we have peers that work with us that help deliver the programs, that support in creating the programs. And so it's consistently kind of feeding back into community in different ways and allowing community to take leadership in things that are really critical and important to our wellness, but also to our ability to thrive in Canada.
That's amazing. I'm thrilled that you guys are doing that as well. And if you wanted to continue also, sorry, I almost skipped the networking. I'm glad that you went back. Yeah, if you'd like to tell us a little bit about the HIV/AIDS program too.
Yeah, for sure. So almost honestly, since the inception of the center, the HIV program has been something that has been built in many, many different ways. Our director, Wangari Thoreau, is a pioneer in HIV research and specifically looking at the experiences of Black folks in Canada. And why this is such an important thing is the reality that, of course, as Kashaia was talking about earlier, we are neglected and silenced, and our experiences in health and wellness are just never centered. And one of the things that it creates is, of course, people not knowing the impact of HIV in a Canadian context, right? And so, one of the reasons why it came to be is as a result, right now, for example, so Black people in Ontario take up about 5 to 6% of the population, but can occupy up to 25% of the newly diagnoses of HIV in Ontario, which of course speaks to the inequities that are happening. And so, what our HIV and AIDS programs look like is a combination of community programs, so very specific workshops, events that support folks that might be living with and impacted by HIV. But then we also do and engage in a lot of research, a lot of ways of being able to capture people's experiences in the hopes to continue to build advocacy. So we're bringing awareness, but funding that allows us to be able to address these issues. And then, of course, providing people individual care, case management to help navigate some of the systems, because, of course, there can be so many complexities that people are experiencing as they're trying to get the adequate care. And then the last piece is that we have ambassador programs that educate folks in communities. So if you're somebody who lives in Toronto, you see us typically in the summer at AfroFest or at many other events talking to people about HIV, about transmission, and just getting the word out there so that people are aware in a different way, but also that we're making informed decisions about ourselves, about our lives.
It's perfect. Absolutely. You also have a section on your website dedicated to research, which is something you've highlighted several times, and I do agree is very important. Some of the research is around chronic illness, determinants of health, primary health care, and knowledge mobilization. Can you each tell us a little bit more about women's health in women's hands, or about why women's health in women's hands felt they should add research to their mandate and what these findings have led to? Kashaia, if you'd like to start.
Yeah, I could briefly talk about research. In regards to creating programs and creating services, there needs to be seen a need as to why these things need to be done. The research that is conducted at Women's Health, Women's Hands definitely is then we definitely are able to identify the issues that are going on within society and then build services and programs based off of that research, which is extremely important because, like I said earlier, the research that to have findings of results or research done on Black women is very scarce. So just having that research aspect within our own community center and then acting on it to create solutions is extremely important because the research is not necessarily outside of our community health center. So we do the research ourselves. And I think that is something that is very proactive and it shows um, the mandate and the actual foundation that Women's Health and Women's Hands is built on, not just creating this mandate to stay up to date with the times, to include Black people and our needs in 2020 or 2021 or 2022, but this is something that the organization as a whole was founded upon, and it allows itself to grow every year with the new things that are coming out, the new information that we are finding, and creating solutions for that information that we find. So we're not necessarily waiting for the world to catch up to then create things based off of what we find from outside, but we find it from within inside and create change that could then reflect on the outside.
Paving your own way based on the findings that you get. Extremely important because, like you said, there often is little research for racialized communities, and especially like you've highlighted, they are not a huge population of Ontario, but still there's quite a few Black people, Black women here, racialized people here, and it's important to tailor these programs to their needs. And if no one's looking into what the needs are, or how these people are impacted, then what are we basing anything that we're doing off of? Emma, did you have anything that you wanted to add to that?
Just one slight thing. I think I wanted to pull an example. I think during COVID, for example, we saw this in action, right? That the minute that we started to think about, okay, what's happening in Scarborough, what's happening in the west end of the city, automatically we were seeing who was most impacted by COVID. And so what Kashaia said so beautifully was that unless we're capturing, detailing, and documenting our experiences in this way, then it forces us to be able to become the priority and recognize that these are the specific things that are happening on a systemic level. And the only other thing I wanted to just include is that what makes research so unique in our space is that it's not just the staff members that are going up and saying, okay, we're going to research X, Y, and Z. One, it's community sharing their experiences, but also community led. So all of our projects have peers connected to them, and that includes research. So it allows the space for community members to be a part of the solutions as well, which I think is a really important aspect of it. And sometimes folks are not necessarily in the healthcare field, they're just passionate about wanting to create change. And I think it really does allow the space for the research to come off in such a authentic way, but also in a safe and trusting way, right? That it's not just researchers that come into community and then automatically leave when the research study is done. It recognizes that we're consistently engaging and connecting with our community because we are a part of the community.
That's definitely a wonderful way to go about it, like community led, community organized. I think that's wonderful. And you did also give me my perfect segue, so I will continue to ask you, Emma, about COVID specifically, of course, and women's health and women's hands, because I mean, people say that the pandemic is over, and I think that we know because we work in community health that it is not. However, I did want to ask, as we continue to navigate it, if you could give an overview of how COVID impacted the populations that you serve and what the approach of your community health center was to continue to serve your clients, and then how that's adapted from 2.5 years ago up until where we are now.
Yeah, I mean, I think also there are ongoing pandemics, right? Like, and the COVID-19 is intersecting with all the other pandemics and struggles that we're having. And one of the things that I think the pandemic did for so many communities, in particular for folks who are accessing women's health and women's hands, is it took away a safe space for them. It took away a safe haven for them. And then, of course, we think about the social political realities. You know, people are, of course, accessing our food bank more often, recognizing that, you know, people have intergenerational families. So there could be 3, you know, different generations within one home. and navigating how fearful people were to even be able to leave their houses. We have a population of folks that might be impacted by different health illnesses, or maybe seniors, for example. And so mobility was also a very big issue for folks. And then, of course, we know that about 50% of our clients don't have status in Canada. And of course, that creates a lot of complication around employment and around immigration challenges. And so we have all of these things that are consistently impacting people, which means it's, of course, impacting their health, impacting their wellness, and of course, their mental health and abilities to be able to cope. And especially because we are a center for racialized women, trans and non-binary folks, we of course saw the increased experiences of violence, gender-based violence, and also domestic violence happening within folks' homes. And so what that meant was that folks were and still are navigating through many different types of crises. One of our approaches was, of course, as everyone did, was to be able to offer virtual care. But at the same time, although virtual care does open up a space to be able to continue to provide support, it's not necessarily accessible to everyone. We have a lot of folks who might need translators, for example, to access spaces. And there's a lot of ways where virtual care isn't always accessible or preferred for a lot of folks. But that's one thing that we did. Our center never also was closed. We were continuing to provide care consistently throughout the pandemic as well. And so we're consistently trying to adapt to our lives and our reality. The pandemic is not going away. It is still very much here. It's just not being counted in the ways that it was before. But we are consistently going to be navigating through the pandemic. And I think we're slowly begin talking about what recovery looks like, but it's hard to imagine recovery when we're still kind of in the whirlwind of the challenges that it has brought up for people in so many different ways.
Absolutely. And that is something that it has been highlighted several times over, in different podcast episodes that we've done about how different communities can have access or don't, either because of digital inequities, or it's not a safe space for them to talk about the issues that they need to in their home, or XYZ, the list goes on. And so, of course, as you've highlighted, COVID was one pandemic throughout many that really highlighted a series of different issues. Kashaia, was there anything that you wanted to add about how you feel Women's Health and Women's Hands navigated COVID either before or now?
I think Amma pretty much covered it, but I think it's really great to say that we did not close. There are many spaces that many people found and had as safe spaces and spaces that they could go to outside of their homes or outside of work that were completely shut down. And the fact that Women's Health and Women's Hands kept our doors open. And even when we had little wiggle room to have groups of 10 people in a space, as long as it was social distancing, we definitely took advantage of that and allowed people to come within certain spaces to have community engagement, with it being a limited amount, but then also providing a hybrid experience for those who physically couldn't be there, but also wanted to be a part of the conversation, a part of the engagement. We created a hybrid experience for them to take part as well. So that is something that is really great, and I'm really proud of us for.
Yeah, that is amazing. And I don't know that we've had a community health center yet that I've interviewed around COVID that has had to close, thankfully. So another testimony to the model, but I will ask you guys that in a little bit. But before I get to that question, I will ask you both if you see any particular gaps in services and supports for the members of the racialized communities that you serve, specifically for female identifying or non-binary people in the region that you serve. GTA. And if you have any thoughts on how provincial and federal government policy changes or funding could help specifically women's health and women's hands address those gaps. Kashaia, if you wanted to continue.
That was pretty loaded. That's kind of loaded. Can you repeat it again?
Of course. So if you see any particular gaps in the services and supports for all of the communities that Women's Health and Women's Hands serves, and if you have any thoughts on how provincial or federal government policy changes or money and investment would help you address the gaps that you're seeing.
There's not a lot of gaps I find within our center, but I would say because we service a demographic that is often overlooked. And even though we are placed within the middle of the city, many people don't have that experience in many other spaces. So they all want to get in. And to provide proper service, we do have to pace ourselves in regards to how much people we could take in when it comes to specific services. So, yeah, I would say as much as we provide virtual care, we provide a central space that people could come to. The fact that we service across the GTA, it could be overwhelming sometimes. Um, that's where I would say the biggest gap is within that we cannot be in multiple spaces. We definitely try to provide services to people that are more accessible, like to create a more accessible experience. Like I know within my program with serving youth, a lot of the students are they want to be in the space, but then sometimes downtown is too far for them when I'm servicing a youth in the West, or if I'm servicing a youth in Durham. Um, so definitely trying to have collaborations with other health centers and providing the service that I provide within other spaces that are closer to youth, that they can access it better and their parents and their guardians feel safer for them to be closer to home. I think that would be a, a, a dilemma that we sometimes face. What about you, Emma? Do you think there's any more?
Yeah, I think that in connection to your point about, we cannot be the only space, that then there, of course, has to be more funding on a provincial level and a federal level that is really invested in racialized communities, because there can't only be one, two, three spaces when we know the need is so great, right? And that's why, we see the wait list sometimes that we do, or having to navigate certain challenges in connection to being able to provide services to people, is because there's so limited spaces for racialized people to feel safe. And so there needs to be a consistent investment, especially when we know that racialized communities are impacted by so many different social issues that is impairing their health and their well-being. And one of the other reasons why I think it is such a key is we see like what's happening with hospitals, for example. And so if the investments don't happen at the community level, then we're going to continue to kind of see this bubble and crisis in our medical system that literally can't be fixed. So yeah, continued investments is what's really, really necessary. And as somebody who leads a community program, one of the struggles is that sometimes our community programs will get funding for 3 years or get funding for 5 years. But that core long-term sustained funding is often a much, much harder, but is the necessary investment needed so that people can feel really, really supported.
Absolutely. That both of those are something that I do hear often. Of course, like it's more specifically this time for racialized community and investment in them. I think across the board, like of course this is about specifically community health centers, but I think a lot of racialized projects specifically do need more funding. But of course, capacity building and maintaining that and keeping core staff and being able to grow and expand is so crucial, and that funding is definitely necessary. A final question. Do the two of you believe that your experiences working at Women's Health and Women's Hands Community Health Center say about the ability of community health centers to adapt to emerging social and public health issues, and the importance of community health centers with our health and social service systems, which of course the whole episode sort of highlights those needs. Emma, if you would like to start.
Yeah, I think it definitely does, right? You have to, for most community health centers, so ours is a little bit different in the sense that our mandated population is who we serve. But if you think about the context of all community health centers, they're in a very specific geographical location, which means that they have to be connected to community and have a consistent understanding of what is experiences are happening or taking place. And so because of that, of course, then that means that we are really attuned to the public health issues, and we consistently know what's going on because we are either speaking, living, or working within those spaces and have a greater understanding of what's happening. And so, of course, as a result of that, CHCs need to be able to consistently address the issues that we know that we see every single day. And it, of course, is a part of our work, because it's one thing for us to kind of put a bandage on a cut. It's another thing for us to actually be able to deal with the wound. So it's an ongoing journey.
And
Um,
Kashaia, final thoughts on how community health centers emerge and adapt, and what your experience has been like.
Yeah, I'll definitely say I think what also helps in regards to us providing for these many different communities and being in a central space that is downtown Toronto and then being exposed to many different diverse communities is the fact that we don't just serve diverse communities like within the health center that we are within. The diverse communities are the people that are employed there. So we are aware if we have a better understanding of the services that are working because we are part of these communities, the services that still need to be provided because we are part of these communities, and we are the representation of these communities. So the clientele that we are serving, we are definitely a reflection of that clientele within the center that is working, and that also helps a lot in regards to meeting the needs and providing the services that are needed to the clientele that we serve.
Absolutely. I want to thank you both for taking the time today to speak with me about women's health and women's hands. And I'm very excited to say that this is actually a part one. Hopefully, in a few weeks, there should be a part two about some other programs that I was really excited to hear about. When I went to the Action Now conference. But I'm so excited to have heard the scope of both of the works that you're doing and learn more about women's health and women's hands, especially because I'm a Black woman who lives in the GTA. I'm so excited. And I will have to spend some time going over and visiting. But lastly, for anyone else who might be interested in learning more about your work, I'm just curious, what website would they be able to go to learn more about women's health and women's hands? Whoever would like to respond.
Yeah, they can go to whiwh.com to visit Women's Health and Women's Hands. People can print off the intake package and come to the center to become a client. To be able to connect with myself and Kashaia's programs, folks can visit our Instagram page at youth.whiwh. And our Instagram as a community center is WHCHC, and the same thing for our Twitter as well. Sorry, the acronym is very intricate. You're trying to remember.
In my notes, I must have WHIWHCHC 18 times, and I was like,
Yeah.
it's getting to be too many letters.
Definitely.
But no, that's good. Awesome. So yes, women's health and women's hands. I want to thank you both so much for taking the time to speak to us today.
Thank you for having us.
Thank you for having us.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.